happy Friday. Thank you for being here. And my name is Aksa, and on behalf of the Orchid organization, I welcome all of you to our second K-Sex. Thank you. And Shilpi is now going to explain what a K-Sex is before we proceed.
So some of you may have joined our first K-Sex, or you may be part of the school that Aksa, Trisha, Rebecca, and I attend, where we performed a lot of K-X's during our freshman year. However, if you don't know what a K-X is, a K-X is basically where everyone that is attending is now technically the doctor, and you go through the patient's journey and try to figure out the diagnosis. So you see what exactly is wrong with the patient, or what the main reason as to why they came to the hospital today. So basically, a K-X will prepare you more for your future as a healthcare professional if you are planning on going into that industry, especially in direct patient care, as we go through the steps the same way that you would if you go to an actual hospital or healthcare office.
So just to kind of cover some of the guidelines, to kind of give you guys a warning as well, this will be recorded, so please be respectful and raise your hand if you want to participate. We encourage participation because this entirely depends on the audience participating and engaging with us, the physicians. And be kind and respectful towards others, even if you disagree with what someone has to say. There's always a right and wrong way of expressing that disagreement. So just be kind and respectful, and mute yourself when others are speaking, so there's no like background noise when another person is speaking. And have fun. And if you, for some reason, don't want to talk, you can always say your suggestions or comments in the comment section. So our timeline, we're going to start off by introducing the patient, and you can ask any questions you want about the patient. Then we're going to do a physical exam. And so for just to give you an idea of what the physical exams are there, you can take the patient's weight, height, or you can palpate the patient to kind of feel if there's a lump, you can feel the lump to see what it looks like. There's also lab tests, or blood tests would be an example of a lab test, or an MRI. And then finally, we will go over the diagnosis, treatment, and more information on the disease that we are presenting.
Okay, so we're going to start off with the chief complaint in the patient history. Next slide. So the chief complaint. I've come into the hospital today because I've noticed significant changes in my vision and noticed worrying vision loss. Specifically, there's a loss of my peripheral vision and overall blurring. You're muted. So you're on mute.
Me?
Yes.
Okay. Retinitis pigmentosa.
Retinitis pigmentosa. Do you want to explain what that is?
It has to be something with an eye, and it causes like a loss of cones. I believe so. And yes, that. And it's I just know Molly Burke has it from YouTube, and it causes loss in vision. So could be related.
All right, are there any other diagnoses that any of you may have? Remember, participation is highly encouraged, because without participation, we can't really figure out any of our possible diagnoses.
Feel free to type it if you're uncomfortable with speaking out loud.
Okay, I think we can move on because there are going to be other checkpoints later where you can suggest new disease off of information. You're on mute again.
Can you say my name when you're addressing me?
Yeah.
Okay,
what questions do you guys have regarding the patient's history? Alex.
Does the patient have diabetes?
No, I do not have diabetes.
Thank you very much.
Are there any other questions for me?
Alex.
How old is the patient?
I am 65.
Okay. Do you have a genetic history of blindness in your family?
There is a history of eye disease in my more of the paternal side of my family. But other than that, not a genetic history per se. I
And
don't take
Lila is
any,
asking if you're taking any medications.
no, I don't take any medications currently.
Do you have to wear glasses when you read?
No, I do not have glasses. I can't afford them. You someone else asked, are there any previous illnesses? I was I enlisted in the military when I was 24, and I served for 12 years. And following my separation from the military, I was diagnosed with PTSD and military service-induced tinnitus, which is basically the ringing of the ears because of my exposure to loud sounds.
Any other questions? Nope. Okay, moving on.
So like I said before, I'm 65 years old. I'm a Korean American woman. And as I mentioned previously, I enlisted in the military when I was 24 and I served for 12 years. Following my separation from the military, I was diagnosed with PTSD, which is pretty common for those who serve. And I was also diagnosed with military service-induced tinnitus because of my frequent and continued exposure to loud sounds during my time in service. My family history, there is, like I mentioned to Alex, a history of eye disease. My grandfather had a retinoblastoma, which is an eye cancer. And my mother's side of the family specifically has a history of hypertension. When it comes to my social history, though I don't like to refer to myself as this, I guess based off of the definition, I could be referred to as an alcoholic. I have struggled to keep a job following my separation from the military. And as a result, I have lack of access to routine medical care. And I'm homeless, so I live in temporary housing and homeless shelters, which is why I can't afford medications or glasses or any other treatments.
So what is the differential diagnosis after listening to the patient's history? Alex,
Can we add glaucoma to the list?
adding glaucoma to the list.
I shall type it up. I'm also writing these down, so.
Alex, you can explain what glaucoma is.
It's basically some damage to like the optic nerve, which can be from either having damage to the optic nerve physically, or it could be from an increased pressure with, I believe, the vitreous humor or maybe even high blood pressure. So her excessive drinking, and I thought I heard something about hypertension. I'm not sure. Might be because of glaucoma. I'm not really sure, but just throwing it out there.
Okay, I'm sorry if I pronounced it.
Differential diagnoses. Say them now. Lie by your question. I'll say it when we go on to the physical exams. So any other differential diagnosis? Nope.
Remember, when it comes to differential diagnoses, you don't only have to provide potential diagnoses. You can also cross out any diagnoses that you think are no longer relevant, or you could emphasize diagnoses that you think are definitely relevant.
Yeah, so far we have retinitis pigmentosa and glaucoma. So.
And we also got 2 more: optic neuritis or retinoblastoma.
Okay, I have added those to the list.
Laiba, do you want to explain what retinoblastoma is?
Tumor.
Eye cancer, yeah. Awesome.
Yep.
Physical exams.
Okay.
Alex.
Can I ask about how she sees? Like, does she have like a darkening around the eyes and see like a light spot?
Well, she has low responsiveness to light, and she does have a bit like redness. Her eyes are a bit cloudy, but mainly is that her responsiveness is a bit low.
Okay.
And then Laiba asked a question earlier did the patient have any pain while moving their eyes or any migraines?
There is a bit of strain while she's moving her eyes, but there's nothing, but it's not as severe as rather her blind spots that there are. And she does not experience any migraines other than those that are caused by her sometimes traumatic episodes.
Okay, any more questions?
I think we can move on to the.
Okay.
So, through an inspection, we were able to find that she has redness in the eye with cloudy iris and low responsiveness to light, where she doesn't dilate or constrict. And through a tonometry, we measured the intraocular pressure, aka the pressure within the eye, and normally the range is between 10 and 21, but her result ended up to be 24, which is higher than normal.
So this machine over here just kind of shows you what a tonometry looks like.
And you usually get tonometries even at your routine eye exams. So right now her physical exam is more of a routine exam. This is something that actually happens very often. It's usually the machine that like makes your eye feel really dry.
Yeah. However, because she did not have insurance, she didn't go into for routine eye exams, which ended up resulting in whatever complication she has. Lab tests.
What kind of lab tests do you want to perform? Oh, and before we do lab tests, what is your differential diagnosis after the physical exams? Do you want to emphasize anything, get rid of anything, add anything?
Anas said biopsy.
Yeah.
No, first we're going to do our differential diagnosis.
Alex.
Can we add cataracts to the list
Cataract.
because of the clouding of the iris?
I am adding cataracts right now. Thank you.
Can you explain what a cataract is?
It's basically like a clouding of either the pupil or iris, and it like just clouds your vision and can make it like less sensitive to light.
Awesome. Any other diagnoses? Okay.
All right, Aksa, can you go to the next slide that introduces okay. So this is, again, the lab test that you want to order. Since you've already conducted the physical exam and you've heard the patient's symptoms and histories, now we'll look more closely at the core of the problem, because usually any problems with the eye are more internal. So Anas said a biopsy. That's not necessary at the moment because a biopsy of the eye can be extremely dangerous and it usually leads to blindness. So that wouldn't be the first lab test that you would conduct. You would conduct a lot more before it to see if to actually see, but it's not necessary. But then we find that it's not necessary at all.
No, Alex said a visual field. Alex said a genetic panel.
A genetic panel is also not necessary. An angle test. An angle test is necessary, and it shows that the angle is very wide. So that shows that she has no problems in her vision vertically. However, she's showing blindness horizontally, which is the loss of her peripheral vision.
Are there any other tests anyone wants to conduct? Nope.
Okay. So the first test that we have to conduct is a visual field test, which is a test that determines whether the patient has blind spots in their vision. So over here on the right, you see the circled portion, which shows the results from her visual field test. Now, normal results of a visual field test are not nearly as dark as they're shown in hers, which means that there is severe eye damage, which means that she has severe eye damage in both of her eyes, and that is resulting in her poor sensitivity to light. So they're very fixed. They're very fixated. They're not dilating or constricting when the lights are being shined in her eyes, and the very black spots show blind spots in her vision. The next test that you have to conduct is a pupil dilation. So this is a test that uses special eye droplets in order to dilate the pupils so that the doctor can be able to examine them more closely. So the results, as you see in the picture, are that her eyes are mid-dilated and fixed, as I mentioned before. So basically what that means is that usually when you have a light being shined in your eye or anything that's about to obstruct it, then your pupils will dilate. However, otherwise it will constrict. The thing with her eyes are that they're remaining mid-dilated, so they're taking in too much light because of the fact that it has poor sensitivity, and they're fixed, which means that they're not constricting or dilating. The next test that you have to conduct is opacometry, which is a test that determines the thickness of the cornea, so that better evaluates the eye pressure. The thickness of the cornea and eye pressure have an inverse relationship. So the results that you can see from her opacometry are that it shows major thinning of the cornea, as usually it would be more of that dark blue, light blue range. However, hers is more in the green to orange range. So that shows major deterioration and thinning of the cornea, which is also resulting in higher pressure within the eye. The next test that you have to conduct is an ophthalmoscopy, which is basically just an examination of the interior of the eye. So the results are shown in the image, which shows bleeding, which accounts for the slight redness in her eyes, major damage to the blood vessels as they've been obscured, which means that they're obstructed. And there's also blurring of her vision due to the blurring of the optic nerve disc margins. This is a gonioscopy, which is the test that Laiba mentioned. It's the test that views the anterior or the front of the eye in order to determine if there are any defects with the iris positioning. So the results that are shown in the image show that she has a defect that indicates mid-peripheral vision loss, which, as I mentioned before, means that she's showing a bit of vision loss horizontally, however, not vertically. This is the last lab test that needs to be conducted, which is optic nerve imaging. So this is the examination of the optic nerve in order to record any changes that may have occurred over time. Now, most of the time, optic nerve imaging, if you have a history of retinoblastoma as our patient has, you would be getting those fairly often. However, due to the fact that she's homeless and she does not go for routine checkups, she has not been able to get the imaging. So this is her first time getting her optic nerve image, so we can't see any changes that have occurred over time. But the results that are show that there is a major defect because the size of the optic nerve cup, which is a bit more blurred in the normal result, is much, much greater than the size of the optic nerve disc, which is the little black area that's surrounding it. Normally, they have a somewhat similar ratio. However, in the patient's results, the size of the optic nerve cup is much, much greater than the size of the optic nerve disc. So after you heard all of the lab tests that had been conducted and the results from them, what are your differential diagnoses? Is there anything you want to add, remove, or emphasize?
Alex says to emphasize glaucoma. I am underlining it. Are there any that you guys want to remove? So far, the list is retinitis pigmentosa, glaucoma, optic neuritis, retinoblastoma, and cataracts.
All right, we can move on then.
NASA to remove eye cancer.
Okay. Final diagnosis. This is your last diagnosis. So for this one, we ask that everyone who is a participant right now say what their final diagnosis is.
Yeah, so you're gonna come to a consensus to determine what you think it is.
Lila,
Lila says glaucoma. Alex says glaucoma. So are we
go with
gonna?
the final answer, or do you guys have another answer?
Okay.
Okay.
Drum roll.
Consensus is glaucoma.
Our
Yay,
diagnosis
you guys got it right.
is primary open-angle glaucoma.
Yes.
Yay.
Okay, so what is primary open-angle glaucoma? Well, first of all, let's find out what glaucoma is. So, next slide. So just from the name, you can tell a lot about a disease. So the origin and the history of a word can explain a lot about the nature of the illness. So the Latinized form of Greek for glaucoma means cataract or opacity of the lens. Glaucomatos means gray-eyed, or it could be a combination of oma and glaukos, which means the eye, and an adjective that we don't really know. So just based from that, you already know it's kind of like a cloudiness of the eyes, something to do with the eyes, right? So a basic definition of glaucoma is an excessive pressure within the eye that causes damage to the optic nerve, and that causes vision impairments or blindness. So primary open-angle glaucoma, or primary or chronic glaucoma, is the most common type of glaucoma. It accounts for at least 90% of all cases and affects up to or around 3 million Americans. And this type of glaucoma develops over time, unlike traumatic glaucoma, where you accidentally hurt your eye. And in this type of glaucoma, your adrenal canals in your eye are clogged. So if you imagine yourself, tearing up, but the tears don't spill over, they still gradually subside. And that's because the tears are being drained through your canals in your eye. So in this case, those canals are clogged up, and so the fluids don't drain out, which cause an increased eye pressure. So what does open angle mean? So open angle is referring to the angle where the iris meets the cornea, and open angle means that it's as wide and open as it should be. So it's not like it's squished or something. So if you look in the image in the red text, it shows a open angle. If you could go back to the other slide. And go back to the next slide, and you could see a closed angle. So this is called angle closure, and it's not the type that we talked about. This is where a closed narrow angle restricts the eye fluid and stops the drainage. And on to prevention and treatment. So for prevention, usually to detect this kind of glaucoma, you should have regular eye exams. And this is the current best form of prevention for this. Glaucoma has hard to notice symptoms, so it's important to have a professional check it out. And significant glaucoma damage can be avoided this way. So if you're under 40 years old, you should get an eye exam every 2 to 4 years. When you're 55 to 64 years old, maybe every 1 to 2 years. And if you're older than 64, every 6 to 12 months. If you're at risk, which means that you're of African descent, or you have diabetes, or you have a family history of glaucoma, you should get tested every 1 to 2 years after you're 35. So continued. So basic exercise like just walking or jogging like a couple times a week will lower your IOP, which is intraocular pressure. And if you're doing some sort of project at home where you're building something and something could hit your eye, you should wear protective eyewear, because although this doesn't prevent against primary open angle glaucoma, this can prevent other types of glaucoma, like the traumatic glaucoma or secondary glaucoma. And treatment. So there's no cure for glaucoma, but there is treatment that you can take to lower your IOP. So that's the goal, to lower your intraocular pressure. And I just want to say to always follow your physician's advice, and don't take our information for medical advice, because this information is for general awareness and education only. So one of the treatments are prescription eye drops, and these improve how fast the fluids can drain from your eyes, and you might need more than one type depending on how much you need to alleviate the pressure. Then there's also oral medications that also lowers IOP, but it can cause side effects such as frequent urination, tingling in your fingers or toes, and a stomach upset. There's also laser therapy, or laser trabeculoplasty. I swear I practiced this before. So this is where a small laser beam opens up clogged drainage networks or trabecular meshwork. And there's also filtering surgery, which is a trabeculectomy. And here, a surgeon creates an opening in the sclera, or the whites of your eyes, and removes a part of the trabecular network. There are also drainage tubes, or where basically a small tube shunt is inserted into your eye, which drains the fluids and reduces IOP. And lastly, there is MIGS, or minimally invasive glaucoma surgery. This lowers IOP, and despite the word surgery in the title, it actually has less risk of like infection and other damage than a trabeculectomy or installing a drainage device. And there's also less immediate post-operative care.
So thank you for staying with us for this long. I know this was like an hour long, but that's okay because we learned a lot. But other than that, thank you so much for joining our August K-Sex. And if you are interested in joining our organization, here is the information to join us. Or if you have any comments or suggestions, please feel free to share.
We have a lot of stuff in the works. We would really appreciate if you joined us and helped grow our community. And yeah, thank you.
Yes, CaseX is a monthly event. So if you want to stay tuned, join our Instagram, YouTube, LinkedIn, anywhere you can find notifications for our next one.
Thank you.